Hi, I'm Inanna Carter,
My name is Boris Pavic,
and I was at Mseleni in rural South Africa in the KwaZulu-Natal province.
and I had the opportunity of rotating through obstetrics, labor and delivery, the outpatient department, which consisted of urgent care, trauma and resuscitation, and emergency as well. And then we also got to do a little bit of work on pediatrics and the male and female inpatient wards.
We were lucky enough to have two University of KwaZulu-Natal UKZN medical students rotating with us at Mseleni Hospital. They were both 6 years, which is the final year of their medical school training, and we got really close to one of the students, Cleo. She helped us dissect a lot of the different racial dynamics and patient encounters and told us a lot of really important things about being culturally respectful and what that meant in that community. She told us that the main greeting, sawubona, sanibona, that you say to a patient or anyone that you meet in the isiZulu culture, what it means is, I see you. And I felt that was really powerful and helped me to understand, one, why it's so important to greet and respect, especially with a history of apartheid in this country. And it was that's sort of one example of why it was so valuable to have these local South African medical students rotating with us.
We had the opportunity to visit a traditional South African healer who's called Sangoma in his healing space in this hut that he creates, where he will see members of the community that are seeking traditional treatments for various ailments. He often would sometimes even take patients that came to him for seeking traditional treatments, and once he identified what was going on and that they would be a better candidate for let's call it Western medicine, he would actually escort them himself to the hospital and had a very close relationship with a lot of the doctors there, which we found very interesting. So he was a Sangoma that recognized that there needs to be partnerships between traditional medicine and Western medicine. And I think it's important to recognize that Western medicine doesn't have all the answers just yet, and that just like the Sangoma knows his limitations, I think it's important that we recognize some of our limitations at the moment and really create a marriage between traditional medicine that's rooted in thousands of years of ancestral knowledge, as well as some of the modern evidence-based treatments that we have.
One really special moment, we had stayed to remove a bullet from this man's leg. He had two. Our supervising doctor, Dr. Mwila, said, okay, well, I'll let the students do it if the patient was okay. And he said, yes, please just remove it. And Dr. Mwila said, you've kind of gained my trust. Me, Boris, the other UCLA med student, and Cleo, the med student from UKZN, he sort of let us three take charge. And we all had our different roles. We got to plan, prep, drape the patient, decide where we're going to do the incision, dissect in, remove this bullet. And we felt just so unbelievably happy after, and so grateful to Dr. Mwila for trusting us and staying late. It was 9 p.m. by the time we left to let us do this procedure. Later, he thanked us and said how wonderful it was to have such engaged, excited medical students he felt that he could trust to do something like that. And it was so funny because we thought he was just doing us this favor sort of by staying late and letting us do this. And it was really nice to know that just gratitude and excitement was mutual. And the last piece of the story was when we rounded on the patient 2 days later. He said, I'm free of pain, thank you so much. So it was a really wonderful experience, just one of many.
Even if global health might not be in their future as part of their practice, I think there's something to learn from working with other communities, other languages, other people in other countries that we can bring back to better serve patients that are here next door.
I think the global health opportunity was an incredible experience that any medical student can benefit from training at another hospital, from seeing another system, and especially if that system is out of the United States. And I think it makes you, one, have a lot of perspective and gratitude for what we do have just at our fingertips here, especially at UCLA, but at many hospitals in the US. And it was just a life-changing experience with connections that I hope to uphold throughout the future.